and I am the Executive Director of Friends of Sheba Medical Center. For 50 years, the Friends of Sheba in Los Angeles have been supporting Sheba Medical Center, now recognized for the second year in a row as one of the top 10 hospitals in the world. On behalf of our board of directors, our professional staff, and our community, thank you so much for being here today in our virtual salon that's presented with passion and creativity by the Daughters of Sheba. Sheba Medical Center is the largest hospital in Israel and in the Middle East. Founded in 1948 alongside of the state of Israel, today Sheba has become one of the most preeminent hospitals in the world. Sheba has over 2,000 beds, 150 buildings, and treats over a million patients every single year. 21,000 cars drive through the gates of Sheba Medical Center every single day. And everything happens on one campus that's located on the outskirts of Tel Aviv. So if you're joining us today and you've never visited the medical center before, please be in touch with us. We have to get you to visit Sheba, and Sheba will welcome you certainly with open arms. Since February, Sheba has treated over 700 patients with coronavirus. And actually, as we speak, 34 patients are being treated at Sheba for COVID, and 18 of them are in critical condition with 2 on ventilators, and we pray for their full and speedy recovery. Just yesterday, so today's Wednesday, so Tuesday, 31 people were tested at Sheba's walk-up COVID-19 test tent outside of the emergency room, and 12 of those 31 people tested positive. So this percentage, which is about 39%, is far higher than the national average in Israel. So why are we bringing this all up now? Because it tells us that this pandemic is really far from over, and your support of Sheba has really never been more meaningful. Whether it's support for the COVID-19 emergency fund at Sheba, or by joining us today, if this is your first event, to hear how Sheba is improving the future of healthcare in Israel and globally, we want you to know that we appreciate your friendship. It is now my pleasure to introduce you to Rachel Roth. Rachel is the event chair of today's virtual wellness salon, who will give us a formal introduction to our esteemed guest speaker from Sheba Medical Center, Mrs. Gila Bronner. Rachel, thank you so much for putting today together.
Thank you, Molly. Good morning, everyone. My name is Rachel Roth, and it is my honor to be the chair of today's virtual wellness salon featuring the amazing Mrs. Gila Bronner. On behalf of the Daughters of Sheba, thank you for joining us today. Mrs. Gila Bronner is the founder and director of the Sex Therapy Service and Sexual Medical Center at Sheba. Gila is a certified sex therapist and certified supervisor in sex therapy. She holds a master's in community medicine from the Faculty of Medicine, School of Public Health at the Hebrew University, and a master's in clinical social work from Yeshiva University in New York. Gila has published scientific papers and articles in various medical journals and medical textbooks, including Oxford and Cambridge. She has also published sex education books for both children and adolescents. Gila is invited to speak at meetings all over the world and volunteers her services extensively for many organizations, including but not limited to the International Society for Sexual Medicine, the Israeli Association of Sex Therapists, World Congress of Parkinson's Disease, and the Israeli Family Planning Association. Gila speaks 7 languages: English, Hebrew, German, French, Spanish, Italian, and Polish. Before we officially turn the program over to Gila, we have a few housekeeping notes to share with everyone. Please note that today's event is being recorded and you will remain on mute with your camera off for the duration of today's event. If you have any questions for Gila before, during, or after her presentation, please submit them in the chat box at any time. Gila will do her best to address all of your questions. So now it is my pleasure to formally welcome Mrs. Gila Bronner to begin her presentation.
Hello, good morning to all of you. For me, it's evening, of course. I'm in Israel. And I would like to share with you some of my experience and point of view. And let me start with sharing with you with the presentation. Just a minute. Okay, it will take me a minute. Yeah. So we are talking today about love and sex, actually sexuality, in the times of the coronavirus, but also generally. And when I start my presentation, actually I have to give a short disclosure that my talk is relevant to all sexual relationship diversity, meaning homosexual, heterosexual, solo sex, transgender, people with different gender identities, but in order to make the talk fluent, I'm taking the major model, which is heterosexual model. But you have to remember in the back of your mind that everything I say is actually adequate to all other diversities. So let's start. And actually, even from the earliest time, sex was mentioned in religious texts. If you want to open the Bible, Leviticus, Vayikra in Hebrew, you can see that the Bible addressed incest and homosexuality and even zoophilia. For example, the Lord spoke unto Moses saying, do not dishonor your father by having sexual relationship with your mother, sister, daughter. They actually put it in details. And also do not have relationship with a man, do not have relationship with an animal. And if you go to Yechezkel, chapter number 16, you will see that the prophet refers to sex toys. Yes, there were, at that time, there were no vibrators, no batteries, but look what he is writing. Actually, the prophet is saying, you took the fine jewelry I gave you. You made of my gold and silver, and you made male idols, and you engage in prostitution with them. So we do not invent almost anything at this time, except for some of the, I would say, media, new technologies, which I refer a little later. Let's look at Maimonides, so it's called in Hebrew the Rambam, and he quotes the Mishnah, and he talks about the style of sexual relationship. And what does he say? Do not have intercourse while thinking of somebody else, while drunk, when one hates the other, or when one is asleep. And what he says when he quotes the Mishnah, he says intercourse should be mutual, should be from mutual desire and happiness. So then he says, many people ask about the frequency. They want to know, how much should I do? How much should I have sex? And he said frequency of sex can be based on husband's profession. For example, and he gave all these examples, workers and tailors and builders twice a week, only if they work in the same city, but once a week if they work in another city, because transportation at that time was not that easy. And then he talks about traveling salesmen. For example, those who were working with donkeys or camels. Once a month is their duty for sex, and sailors once in 6 months. So what do we do today when we have other professions? A pilot, a physician, a teacher, an engineer, a driver, high-tech employee. What is the right frequency? Actually, we don't have the right numbers and we don't know the answer, but it is still a very interesting one. Let's go a little further. And when we look at sexuality and we look at sex and we look at sexual health, we see that they are surrounded by legend, urban legends, by myth, by misconception and misinformation. Even today, when we have so much open information over the internet, it is usually mixed like a salad together with false information and with true information. So let's look at some of them. One of the most frequent myths is the myth that sexuality is only intercourse and orgasm, and not. Sexuality is much more than just intercourse and orgasm. Let me show you what I mean. So if I look at sexuality, it has three very important aspects. The physical aspect, like hugging, touching, caressing. The emotional aspect, like loving, caring. And the intimacy aspect, which means the intimate aspect, which means sharing something in a very intimate way, physically and emotionally. But much more important than this, most of the people are not aware that there are two types of sexuality: the non-erotic sexuality and the erotic one. And all of them comprise together our sexuality. So we can have physical sexuality, like I'm hugging a baby. This is a non-erotic sexuality, but it gives the baby feeling of being protected, being loved, being covered with the warmth, with the human warmth. And this is actually the first steps that build this baby's sexuality in the future and his ability to build the intimate relationship and erotic sexuality. But the same physical touch can be designed or targeted to increase excitement, arousal, and reach orgasm. And the same goes for the emotional and intimacy ones. So I will keep on the next one, which gives all the information in more details. But I would like to go to another aspect which is very important. I don't know if many people know that sexuality in its broad way, I mean the non-erotic and the erotic sexuality, has really health benefits. For example, many studies show that touch and massage reduce stress and pain. Where? In breast cancer patients on chemotherapy, in stressed old adults, in demented adults like Alzheimer's disease, nurses who work in high stress work environment, women with menopausal complaints, people with migraines, children and babies. We decrease stress and decrease pain. What happens? How can it be? So what happens when we have erotic or non-erotic sexuality? Happiness hormones are secreted in the brain and they are increased. For example, the oxytocin, the endorphin, which are stress relievers, they give us good feeling of being loved, of being able to love. And at the same time, stress hormones like the cortisol and others are decreased. When does it happen? As I said before, when we hug, when we kiss, when we cuddle, when we caress, when we touch, or during sexual arousal and orgasm. Okay? So, if we look at the 21st century, you know that we are living in a period of a lot of touch, but a lot of touch on screens. And actually, the human touch becomes precious. And one of the problems is that we have hungry skin. Our skin is hungry for touch. And one of the problems is that we combine together, when we are adults, we stopped being babies or children, we combine together the non-erotic sexuality with the erotic, meaning that let's say that I'm standing at home and doing something and my husband is coming and he hugs me. And I remember that he's doing things together, meaning that When he hugs me, he means that in a few hours, I have to plan to be in bed, free of thoughts and free of any chores, and be ready for sex. And this combination between the non-erotic sexuality and erotic sexuality affects men and women, and it reduces the non-erotic part in their life. Meaning that we touch only when we plan to have sex, which is very bad. And if at your home it is different, you can bless God that this is good, actually. So I give you homework. Now, the friends of Sheba will not check the homework, but what I offer, the homework assignment, is to find someone that you can hug, and just hug for 1 minute. And 1 minute hugging is not like this, and it's not moving your hand, it's just in a very relaxing head, finding a baby that you can hug, don't kidnap someone, finding a person that you can hug, and just hug for 1 minute, breathe this hug, and you don't have to move, just listen to your body. And this is enough for the increase of the happiness hormone, for the decrease of the stress hormone. And actually, if I think of the period of the COVID pandemic all over the world, this is what we need: a reduction of stress, an increase in happiness, and we can reach it very easily. Let's go on. But today, we don't have only sexuality, the erotic and the non-erotic. We have now something new, really new. We have something which is called digi-sexuality, and it is slipping out of the closet, and we have to keep an open mind. What do I mean when I talk about digi-sexuality? Actually, I talk about the first wave of digi-sexuality technologies, which all of you know. And this is dating application or dating sites, live cams, porn, chatting, and intimate chat, and sexual chat, and erotic chat, and Skype, which we can use for sexuality, and remote sex technologies. One of the modern one is the teledildonic, which I can be far away in another country and use these devices to feel aroused, excited, and being touched. And this wave of digi-sexuality technologies is already absorbed in society. We are used to it. Today, most of the couples, I even had patients last week, they were about 65 years old, and they told me that they met in one of the dating application, of course. So what does it give us? It supplies us with super normal stimulation, with novelty. You can look at it even if you are not browsing the internet for sexual issues. Just opening Google and put a name or a topic that you are interested in, and immediately you have so much novelty and constant surprises, and you control the satisfaction. And when we talk about sexuality, you have this novelty and surprise and multi-partners. But we did not stop there. I don't know if you are aware now, all over the world, we have the second wave of digi-sexuality technologies. What am I talking about? Robots, remote sex, virtual reality, augmentation, and immersive entertainment. If you have time, I recommend that you open this report. It is called Future of Sex Report. And you have a very interesting report about these new technologies. So if we look at them, we know that today sex is starting to change. In the future, we will design our sexual environment and body. We will turn ourselves, if we want, into an avatar, or maybe we'll turn another person into ideal partner. We can choose the erotic interactive story, or the plan roles, select the perspective view that I want to look at the action. I can add remote toys. I can add gadgets and clothes which are equipped with sensor and bring holographic representation of someone, and use BCI, as you can look here on the left side, is brain computer interface to use the effect and enjoy full body experience. Now it looks to you as irrelevant. It looks to you as maybe something imaginative, but we start using it for people with disability. For example, we are using the VR for people with various disabilities in our hospital in order to regain the ability to feel, to touch when you are disabled or when you have some neurological disorder. And due to this disorder, you lose sensation in some parts of the bodies. So some of these are used not just for pleasure, but really for rehabilitation. So this is, it looks for us as a future, but it's here. Now I want to share with you some of Sheba special projects in the areas of sexuality. One is Porn Awareness Project. We know that young people at the mean age of 11, meaning between the age of 8, 9 to 14, 13, young people are exposed to porn. And we wanted to increase their awareness of all these adolescents to the risks. Now, I cannot, as a sex therapy, who is too old for them to talk in their language. That's why we cooperated with a high school. An high school which has a special class where they study new media and digital technologies. And we gave them a challenge. They were a class of 17 years old students. And we asked them, can you produce a docu-film, videos, teasers, and also build special sites with relevant information, but designed to young adolescents. So we did it, and it's on the internet. This is one of the first project that we did. Why we do it? Because the supernormal stimulus, which people get from internet porn, with the endless sexual novelties and expectation, and it changes the mind of young people. And it changes because it elevates dopamine. And dopamine is a neurochemical or neurotransmitters, which increases our seeking, craving, and wanting motivation and the excitement. And what happens is that dopamine makes the brain believe that what you are doing now is the most important. And the result is that young people, when they reach sex at the age of 20, 25, 30, their brain is already sexual conditioned. They lose some of their ability to feel. And sometimes they are having sexual problem, and we have to treat them. And I would like to tell you that, for example, now during the COVID, in the months of May, June, July, and August, we had a rise of people applying to sex therapy, an increase of 30% in comparison to last year, same month. And the people who came to us were young men. Most of them use too much porno because of anxiety, because they want to relax themselves, because of boredom, because of feeling lonely, and they cannot, it interacts with their sexual intimacy. And many of those who came to us were at their 20s or 30s. And some of the women come because the women react to these problems. So we have a problem that today we are in a period where we ourselves by clicks We control our drive, our dopamine levels. And the surprise is that we have increase of sexual problems among young people, especially among young men, who lose their desire, lose their erection, and lose the ability to reach orgasm already at the age of 20 to 30. And we have to treat them. And when they are bored and they have erectile dysfunction, they affect the women. So we have young women at the same age with pain disorder. Now, Israel is not unique. I get the same report from all over the world. I mean, in Muslim countries, in Asian countries, in European countries, and also in the America and Canada. So we have in young people erectile dysfunction, anorgasmia for men and women, problems with concentration, a lot of fatigue, lack of motivation, social anxiety, and they decline any interest in real partner. And these are some of the challenges that we have already in the last few years, and the COVID-19 just increase the problem and increase the frequency of this sexual dysfunction. So it affects couple relationship and it creates female sexual dysfunction. And this is the field that we are fighting all the time. The second special project that we did was due to COVID-19. We did an internet survey, which I did together with Mia Magnat. She is a master's student at the Haifa University, and she is expert in technologies and technologies designed for sexuality. And what did we find in this survey? So the purpose was to investigate what changes we can find in the use of digital technologies during the coronavirus isolation and lockdown, and the change in the use of these digital technologies for creating sexual or intimate experience. And the digital technologies that we were investigating were sexting, social media for sexuality, video chat, intimate video chat, erotic material like video stories or porn. What did we find? We found, just a minute, yeah. We found out of 180 people who responded that women and men, the current use during the COVID-19 of erotic material, in men, it stayed very high. 55% of them used it, in spite of the fact that 18 decreased the use due to this pandemic. Women, only 27% of them use any erotic material. Usually women read stories, erotic stories, or erotic books. Men usually looked at porn. But very interestingly, women stayed active using sexting, which means sending text or pictures in intimate form to some partner. They still were video chatting, but men reduced it by very high percent, meaning that due to COVID-19 and isolation, men stopped having intimate connection and using digital technology for this connection. And you see 68% reduction in men in comparison to women, and 88% reduction in video chat in men in comparison to 39 in women. So men, knowing that I am not dating because of the isolation, I'm not dating because of the limitation, then I stay with the porn. And women, on the other hand, stayed and kept communication with men. And the reduction in men was very high, except for porno. The third project that we did was blog series, which I was writing The name of the blog series was 3 Steps to Maintaining Intimacy During the Coronavirus. And this was designed for people with neurological diseases, with diabetes and other chronic illnesses, and also designed or directed to their partner in order to keep couple relationship, couple intimacy, and couple sexuality either non-erotic or erotic. This blog series were published over the internet in many countries and translated into many languages, also, of course, in Israel, in Israeli sites. So these were the projects. So what do we do with the sexuality generally in a period of digital technologies, of digisexuality, in a period where people miss touch and they have this hungry skin? What do we do with sexuality? We have to think out of the box. And thinking out of the box means stop focusing on performance, because this increases pressure. Instead of performance-focused sex, choose pleasure-focused sex. And this is the way that we treat our patients. Now, just I told you about the increase of patients. In the last months during the coronavirus pandemic, we have every month about 350 clients coming with problems. And they don't come just for one session, because sex therapy usually takes more. It takes sometimes between 10 to 40 sessions. It depends on the problem. So what do I mean when I talk about pleasure-focused sex? Actually, I say open your sexual menu. Be more creative and be more flexible. Now, you don't have to imagine it or write everything. So first, have non-erotic touch as a portion for itself, like lying in bed, hugging one another for 1 minute and going to sleep. Every hug doesn't have to end with erotic touch. You can touch also one another in erotic way, mutual or in turns, even without getting aroused and without reaching orgasm. Yes, it's like going to a restaurant and I can have a very big portion. I don't have to finish the portion and leave a clean plate. I can eat half and say it's okay. In sex, we are not allowed. It's like we got a Torah in our brain that says, no, half sex is not considered, but it's not true. So the non-erotic is one way and the erotic is the other way. And then we have the intercourse. Yes, having sexual relationship with the visit of a penis in the vagina, trying to have orgasm, but we have also outer course. And outer course is sexual relationship without visiting or without penile, vaginal meeting during this sexual activity. And it can be very pleasuring. So we can choose it. We can also discuss sex, talk about sex. You know, like we on TV now, along this period when many people are at home, all the time we have TV shows on food, like competitions, like looking at the way that they are making cakes or making salads or cooking. So what we do, we watch it, we discuss it. We don't cook everything we see. We can share ideas. And in this way, we are having an intimate sexual experience without having sexual relationship. And this is nice. It is pleasing. It is making us very close to one another. Then we can have solo sex, meaning self-stimulation or masturbation. We can do it. It's not bad. And to do all this, we need sexual communication, or open communication. For some people, it's difficult. If it is difficult for you, or for some people, you can go and ask for one session with a sex therapist. It will be easier. So all this is the menu which helps us keep our confidence, keep our healthy, our wellness, our security, being supported, and not being under pressure of performing all the time. And if we add to this the couple intimacy time allocation model, which I composed based on clinical experience of many years, you can also look and take care for your couple time, for your personal time. And when we cannot go out frequently and many events were canceled, we can just make a date at home and plan time, even get dressed, some makeup, some touch at our hair, take a glass of wine and just talk, look at old pictures. But don't forget another time, important time in this time allocation model, which is the personal time. I need also time for myself to be separate, to do things separately. Then we have intimate time, talking, sharing, touching in an intimate way. And we have the erotic time, the arousal, the trials, or trying to reach orgasm. Not always we succeed. And all these together help people when they are in couple relationship. If you are not in couple relationship, you can find an intimate way to be with yourself. You can find personal time to feel good with yourself. And you can find erotic time to be with yourself. So this model is very important for us. And actually, we finish with this part where I gave you some ideas of the way that we work here in Sheba Medical Center, and the way we help people to construct their intimate relationship, which are so useful, especially for people who are coping with difficult or disabling illnesses, and especially in this period of this epidemic all over the world. And here you can see all the places where I visited. I did not show you all the places that I did not visit, like I had a planned visit to Los Angeles, and another one to South Carolina, and another one to Boston, and another one to Atlanta, and but never mind, they will come one after the other next year. So this is the end of the lecture, and thank you very much for listening.
Thank you so much, Gila. So we know you go all over the world to speak, and now of course we're beginning the Q&A session, part of our program. So just a reminder that any of the questions that you send in via the chat will remain anonymous. So we welcome any and all questions. But Gila, back to the first question, you know, we know you go all over the world to speak. So what are some of the most frequent questions or problems that you encounter in your dealing with people from all over the world?
Actually, the most frequent one is that many of us did not get the permission to investigate, really to listen to our body and share it with our partner. I call it intimate communication or sexual communication. But actually it's, if I will talk about a similar issue, which is the issue of food and eating habits, which are controlled by the same area in the brain of craving, wanting, desiring, and then by satisfaction. When you think of food, if I go with my partner to a restaurant, I don't have to order the same portion that he ordered. He even can order something that I hate, and it will be okay. I can even go with him to a restaurant when I am not hungry because I ate at home or I had a party today, but he is very hungry and he wants to enjoy a restaurant, and we can sit together and I'll have only a glass of drink and he will have a huge pile of hamburger with fried chips. Why can't we do it when we talk about our sexuality? Share the difference. I mean, the difference, if I'm not hungry and I go to a restaurant with him, he doesn't have to be disappointed or insulted. It's not against him. And vice versa, of course. So sharing and talking is something mutual. Of course, in various culture, it is different. In some places, they talk more openly. Israel, in spite of its religious community, is more open to talk about sexuality, but still we have many people who cannot talk about it. There are some places, for example, I was lecturing last year in Japan, and in Japan, a man and a woman do not talk any intimate issues, not sexual, intimate, personal. So it depends on the culture. So this is the main problem.
Great. We have a question here that asks, how do you successfully deal as a couple with different levels of libido? Do you have any tips?
Well, when we have to check, libido is a very, I would say, mysterious issue. I'll tell you why. If I want to do something which will, at the end, will give me pleasure, I have two ways to reach it. I'll give you an example so you understand how it works for sex.
Great.
Let's say that I don't talk about sex, I talk about sport, going to the gym, okay? I can go to the gym because I want to go to the gym. I desire to go to the gym. I dream about it, okay? So what do? I have to change my clothes. I have to take my sneakers. I have to take a towel, to take my bag, to drive or to walk, and to go to the gym and do whatever I need. When I do all this activity, the brain increases the level of adrenaline, which is the energetic neurotransmitter. And when I start doing any gym activity, after 10 minutes, my brain increases the level of endorphin and oxytocin, and I'm happy. And when I end the sport, I end the training part or the class, I am happy. And I think, wow, it's great. Next time, I don't have the desire to go. I force myself to go. What do I use? Not the libido, I use the motivation. And the motivation is these sentences that are implanted in my brain, and they say go, because when you go, you are so happy. When you go, you feel better with your body. You sleep better. You look better. So force yourself. It's like forcing myself, but it's not. It's actually engaging motivation. And when I reach the end, I will have the same pleasure. Now, if you think most of the things that make us happy, we can reach them by these two paths, the desire path and the motivation path. Without the motivation path, we would not reach many of our happy moments. So if you ask me about libido, what we have to check is why the difference in the libido is there. Because if you are a man, you have a very big motivation to have sex. Because unfortunately for all men, one of the myths in the world, a myth which is actually I find it almost in every country, is if you do not desire, if you don't have the right libido and you don't desire sex, you are not a man. Go out of the world. Go live on Mars. You have no rights to stay here. Okay? But a woman does not have it. So motivation in men is higher. And they combine the motivation with a hormone, which the hormone is very important. This is the sex hormone, the testosterone. Our brain, meaning the female brain, does not have this supply of sex hormone. So we have to use motivation. But if the experience is bad for me, then I lose also motivation, my libido is low. So the question is very intriguing. Actually, I have to investigate. So sometimes my libido is low because I don't enjoy what happens there. Sometimes my libido is low because I don't know how to ignite the system, how to recruit my motivation. And sometimes the motivation is low, for example, today for young men, because I look at porn and porn excites me in a different way. Now, libido is also a problem of menopause because of change of hormones. Libido is also a change of hormones in men, low testosterone. So the question is, what do we do when we have different libido? First, check and see the reason. Now, let's say that there is no reason. Everything is okay. The sex is okay, the hormones are okay, the couple relationship is okay, everything is okay. Then we have to think what we do with different libido. And the answer is the same what we do with a different desire to go to dance, with a different desire to go to see a movie, with a different desire to go for vacation. We have to discuss it. We have to negotiate. And one time I will go with you for you, and the next time you will go with me for me. It will be different. So the answer is really complicated, but this is one of the biggest questions.
Great. Well, you answered beautifully. How do you maintain, we have a question coming in that asks, how do you maintain desire in the same person in your whole life?
It's difficult, of course. So first, keep all the things that I said. I mean, have a very rich menu. If your restaurant has only one line in the menu, which is called the intercourse, you will be bored immediately after a few years. But if your menu, your restaurant, sexual restaurant menu, has many alternatives, like hugging, like giving massage to one another, like sitting in front of the screen and looking for a YouTube, an erotic massage on YouTube, not porn, and trying to find something that I like. And I'll look at it and I'll say, wow, this I want. Can we try this one? And you will, and my partner will choose something else. Read about it, talk about it. It will not be the same, but it can be good for many years. I want to share with you, 2 months ago, during the lockdown in Israel, a very dear friend of mine died. He was 94 years old. Why do I call him a friend? I call him a friend because he came to me for sex therapy when he and his wife were at their 80s. And they wanted to find something better, to do things better. And all the time he said to me, look, when you look at her, think of a present where the wrapping paper is very wrinkled, but inside there is a treasure in the box. And they liked the sex therapy very much. And from the age 80 to the age 90, once a year, they came to me for one session for, renewing, listening to new things, listening to new ideas. And the thing that they say is that we touch one another and whatever happens is good. Sometimes I have an erection, sometimes I don't have, sometimes I have nothing at all. Sometimes she is lubricated, she is not lubricating. They reach orgasm, they don't reach orgasm. They say that the enjoyment that they take out of these intimate moments that they can care for one another are great. So what I'm saying, enrich your intimate menu. And if you can't do it alone, read. There are many books. Don't take suggestions that you don't like. Be true with yourself. And if you want, use a therapist, sex therapist, for 1-2 sessions and get more ideas.
Great. Gila, can you tell us, some people are joining us today who might be a little bit more unfamiliar with Sheba Medical Center than others. So bringing it back to Sheba for a minute, what is an example of 1 or maybe 2 advantages of you and your work by working with Sheba and by having your center and seeing your patients at Sheba?
Yeah, one of the problems is that in many places in the world, people from medical professions do great job, but they don't relate to sexual changes, to sexual rehabilitation, and to the effect of the disease or the treatment or the surgery or the medications on the ability of people to keep their intimate relationship. And the fact that we are there and patients can come to us for consultation, for example, in oncology. I'll give you an example. A young woman who has breast cancer, and she's on chemotherapy. The chemotherapy brings her to a chemical menopause, meaning she has hot waves, she suffers from hot waves, her vagina is dry and painful, and her libido is decreased. Let's say that chemotherapy will continue for 5 years. During these 5 years, we want to train her vagina in order to keep it not atrophied, not to have atrophy in the vagina, in order that after 5 years, she can invite her partner's penis to visit her vagina. And during these 5 years, when she cannot have intercourse, I don't want that the situation will spoil the couple relationship. And since doctors and nurses are not trained, well trained, how to talk to patients about sexuality, all over the world, it's the same. And many times they ignore this part, our ability to keep the strengths of a couple, to keep the relationship, and especially to rehabilitate it so that after they are cured, they still have a family. But it happens also in more daily issues like fertility treatments. During fertility treatment, the fertility interventions of the staff steal from each couple their desire, their ability to want to crave for one another, because they get so many assignments. Like today have 2 times sex, and then tomorrow have 1 sex in the morning, and immediately come to the hospital for intravaginal check in order to see. And then you come and give your sperm, and you have to do it in a room in the hospital, and to masturbate and to give a sample of semen. This couple lose immediately their desire to have sex. They get scared. Their anxiety is so high that you can't believe it. And they are afraid that they will lose their ability to be sexual in the future. And for example, when they come to me, to us, to our sex therapy service, what we do is we say, good, at that time, stop having intercourse. There is no reason that you will have desire, natural desire for intercourse, but you can hug one another. Yes. You can touch one another. Yes. You can have non-erotic sexuality in the meantime. Yes. The same goes for women who just gave birth and they are breastfeeding. And while breastfeeding, they lose their desire. Their vaginas are very dry, and painful sex is terrible during intercourse. So they get a lot, they get intervention which is very short, sometimes just one session, sometimes 2 sessions, just saying, wait, keep your intimacy, have sexual relationship without touching the vagina. You can help your partner to be aroused also during intercourse and not intercourse, but just be a couple. Because I want, after long months or years of fertility treatment, to have a couple, not to have a man, a woman, and a baby. I want to have a family. So this is what we are doing.
Okay. So we have time for about 2 more questions, and I'm seeing one just come in that's asking, do you have any suggestions, Gila, for sex after menopause?
Sex after menopause should be like sex before menopause. It is the same. The only thing is that I suggest that women will get proper counseling. Now, most of the gynecologists in Israel are not interested in women after their 50s. Why they are not interested? Because the younger woman, you work and you have a lot of procedures. And the procedure make you feel important because you send them to ultrasound, you send them to have some lab tests, you prescribe them medication, you follow pregnancy, you follow fertility problems. But when I come to my 50, I need a doctor who sits with me for 20 minutes at least and listen to all the systems in my body that are affected by the reduction of my sex hormones, the estrogen, the progesterone. Because there are changes in sleep, there are changes in the skin, there are changes in the air, there are changes in the mood. There is more nervosity, irritability, sometimes light depression, anxiety, sleep problems. There are problems with digestion, there are problems with constipation, there are problems in the urine system. I need someone who looks at all of them, and not a physician who comes to me and say, no, you don't need any hormonal therapy because you don't have heavy problems of heat waves and you don't need anything. It's not true. Women in the last, women about 150 years ago died 2 to 5 years after menopause. In Africa, still today, in the country which is called Chad, the average of women's life is 55 years. Wow. They die at 55, meaning that today, if I live until the age of 90 or maybe 80, I live between 30 to 40 years and my body misses the hormones because estrogen is in charge of my heart health, of my fat and cholesterol and triglycerides, of my Alzheimer's disease. The estrogen reduces many cancer diseases, and there are many other problems like mood, depression, and the only question is about breast cancer, which it might increase slightly. So if you ask me about sex after menopause, I would like that you go to a doctor who likes women in menopause. Who is this doctor? Look for those who are expert in menopause, those who are the head of the department in the hospital for older women, or the gynecologist who is in charge of menopause. Look for them and get proper treatment for your problems. And then having sex, if I gave you the menu, all the menu is okay. The only problem is that when I am menopausing, my partner might have a reduction in his hormones, and maybe he may cope with erectile dysfunction. So if we have intercourse, it's okay. If we want to have intercourse, then he also has to get some treatment. So we have to look at the couple during the menopausal time and find the right solution, but you can do a lot of things. People at the age of 50, 60 start to bloom. Children are going away. Job is better. Sometimes financial situation is better. Just bloom and enjoy it.
Yeah. So Gila, I know that you have done a lot of work in kind of the negative effects of pornography in young people today. So can you talk just briefly, or most recently, about anything that you think our audience would want to know about in terms of how it can be positive, but also very negative?
The use, according to all research, and also according to our clinical experience, when a couple uses sexual material, written or pictures or videos, and they use it in order to be more concentrated and to enable them forget the daily chores and the daily anxieties. When couples do it together, usually it is positive. The effect is positive because we use it just to bring us to the right atmosphere. And this is the same as if I go outside and I take the table, I put a nice tablecloth, I light the candles, I put some music, and maybe we eat the same bread with the same butter that we had yesterday, but the atmosphere is different and we'll enjoy it differently. So people will use it for getting the right setting, the right atmosphere, and usually in couple relationship, it is okay. The danger is that we have young people who look at porno and they get the wrong conceptions about, the wrong concept about sex. They get the wrong concept of their role as men, and level of anxiety is very high. And when level of anxiety is very high, they suffer from this low desire and erectile dysfunction. Young people usually suffer from the effect of the porn on their brain. But we as adults can use it for our advantages. When we use it, in the right amount, it's like wine. Good wine is good wine, but when you drink the whole bottle, maybe you will lose the advantage.
Right. All right. So this is our last question. And this is for people who are single right now. You mentioned it's a very difficult time. People are locked down in their homes. They're lacking even a person to give a hug to. So do you have any advice for those people who join us today or are watching a recording who don't have anybody at home right now?
Yeah, so single people should look for a few things. First, for relationship, friendship. Now, if someone does not have close friends, there are today a lot of Facebook groups that one can join according to his or her interest. So this is for the feeling not alone, sharing, socially sharing. Now we have to find ways to touch because our skin needs touch. Now, touching my skin, I can do it by myself. I can do a good shower. I can put cream on my body, but I can also book a massage session, reflexology, cranial massage, whatever type of treatment which has touching in it. You may find it very useful to adopt a dog or a cat because they can add it. If we work with people who cannot treat animals, for example, when we have demented people in institute or at home, the best is to buy them soft stuffed animals, which they can hug like babies hug them, and they will have their hug. So we can find a way to hug and don't stop it. So we need the physical touch, We need the emotional closeness, people to share with them things, and it is possible even if I am single.
Terrific. Thank you. Thank you so much.
Wow, Gila, that was incredible. Thank you for taking the time to educate us. We've been waiting for this moment. We wish it was in person, but at least we got a little to hear a little bit about what you do and how you can help. And I'm very grateful. Thank you. Rachel Roth, thank you for helping make today's event possible. We are so lucky to have you in the Sheba family. To everyone who showed up today, thank you for participating and supporting Sheba, Friends of Sheba Medical Center. Please, please join us on Thursday, November 12th for Sheba Medical Center's first ever international virtual gala that will celebrate the healthcare heroes and supporters of the hospital.
Thank you for inviting me.
Oh, of course, we love having you. Please save the date for the gala, Thursday, November 12th, and stay tuned for more details. I also want to add here that I highly recommend everyone to put Sheba Medical Center on their Google Alert, because you can really learn about all the incredible things that come out of the hospital every day. And it's a good way to get to learn. And also, stay well and have a wonderful rest of the day. We look forward to our next virtual events or in person. Thank you.
Thank you, Shoshana. Thank you, Rachel. Bye, Gila. Thank you for being with us.
Bye.
Bye.
Have a great day.